Hello, everybody. Today is Thursday, June 4th. Welcome back into the Keep Boone Healthy Facebook channel. I'm David Jackson with the Boone Area Chamber. And today we are talking High Country Community Health. And with us, Alex Noriega, who is the Director of Outreach, and Alice Salthouse, Chief Executive Officer for High Country Community Health, valued healthcare partner here in the High Country. And we wanted to talk about some things that are just kind of, some of them top of mind, maybe some not so much, as it relates to how COVID-19 has impacted our general understanding, feeling, and patterns around how we are taking our own healthcare seriously for ourselves, right? So, there have been all kinds of things about, because of the stay-at-home orders and because of the way that we must interact with a lot of businesses and certainly medical practices, people sometimes are motivated not to go to the doctor when that is really one of the worst things that we can do for the long term. So we wanted to talk with our expert members here at High Country Community Health about what some of those trends are, how some of those barriers have been removed, and then ultimately, for people that are experiencing hardship at this point in time, what are some of those opportunities for access to make sure that healthcare is readily available and is something that people feel they can take advantage of. So Alex and Alice, thank you very much for joining us today.
Well, thank you for having us, David. We're glad to be here.
If we can first start off with just kind of a simple introduction, if you guys might mind sharing the mission overall of High Country Community Health. What is it that you all try to accomplish on a daily basis?
Okay, I'll take that one, Alex. We are a relatively young participant in the healthcare of the High Country. We opened for business in January 2013, so we're 7 years old. And our mission is simply to provide quality health care to everyone, regardless of ability to pay. That does not mean that we care for just a niche part of the population, but for everyone. If you have insurance, if you have Medicare, Medicaid, and if you are uninsured, and we have a sliding fee scale for anyone that is low income and uninsured. So we provide health care to all, regardless of ability to pay, and we provide it in a way that I think is very good. Of course, I would think that, but we have what's called integrated care. We have, in each of our sites, we have not just medical, but we also have behavioral health right there, so that you're treating the whole person. We also have 3 dental clinics in the areas that we serve, both Watauga and in Avery and in Burke County as well. And we have several different things. I'm really pleased with our migrant farm worker program. Alex has a big part. She gives oversight to that program, and we go out to the farms and help the folks that are here in our country who may not speak English, who may, but many times the people that need access to health care are the last ones to be able to get it. And so we're here to try to have healthcare equity in our community.
I know that this is a topic that came up very recently in another discussion, another forum that we had, but certainly I think it applies not only to what we're dealing with now with COVID, but also just general health concerns. How important or how much growth, I guess, have you seen in creating a second language program, really, to make sure that those who may not be native to the High Country area that are coming here from other places do feel like they're comfortable in speaking with a physician, comfortable with speaking with care providers that they can have that kind of relationship with, that you thrive in having with your doctor and medical personnel?
Well, as you know, that there's been a very high percentage of the COVID-19 in several communities in the state, in the Latino community. And sometimes in the past, and even now, we hear about the fear factor, where folks are afraid to come because they're here without documentation. And it has been our goal all along to provide care for people regardless of whatever. And in order to do that, you have to be equipped. You have to have that relationship with that community, and you have to be able to speak the language. So you want to speak to that just a little bit, Alex?
Yeah, so we are very, we've gone through some extensive training. All of our interpreters here have taken courses to make sure that we are doing the best job we can with interpreting for our patients and making them feel like they have a personal relationship or a connection to their provider, not with us and then us with the provider. And so we really try to strive to provide the best interpretation services that we can, although it medically can be challenging because of the terminology, and we've got people from different regions of Mexico, different other countries, and so it can be difficult, but we really try our best to help them create that relationship with their providers.
And we do have interpreters in every site, whether it's dental, medical, or behavioral health.
Alex, I think you bring up a really interesting point, and those that like logistical things, right? They think with that kind of mind. How do you plan for that, of having maybe even within the same concentrated group of people that you're working with at one particular farm, folks that are coming from different regions that speak just different variations of the language? How do you manage that from an interpreter standpoint? I'm sure that's got to be really, really interesting to see from a development standpoint, how you make sure you've got all of those things available.
Right. So again, through the training that we've been to, we try to either ask what their background is and try to use words that are more common or commonly understood even amongst different people from different places, and just trying to use the most common words. And if we need to make clarifications, we do that. We may ask, so what did you mean by this or that? If we need to find different words to implement, then or to describe their conditions, then we do that.
Sure, and fascinating, because communication is so important in that relationship between a medical care provider and a patient, to be able to have full understanding of what you're talking about. So really interesting to hear how you're able to tackle that with multiple constituencies that you're dealing with. I guess COVID-19 is on everybody's mind. That's one of those things that we have had ingrained in us for the past few months. How have you all noticed that the COVID pandemic has changed people's access and willingness to access standard healthcare at this point?
Well, it has been a journey, and you know that. You've heard from the other providers and other people in the community, and it goes from those people that I hear say, I don't really believe in the COVID-19. Some people say that, and then you have people who haven't really hardly ever been outside their home since it started. So you've got a very wide thought process for a lot of different people. One of the biggest things that we've done here at High Country Community Health is to have available the ability to either speak over the telephone, or we have a platform, an IT platform called DoxyMe that we use, that enables us to have the patient sit in the room with the physician on the internet and have a virtual visit with their provider. It's not the best in the world, because you may want to have someone's blood pressure checked, or their temperature, or some kind of physical exam. And so it's different for the providers in doing this, but it is a lot better than nothing. Another challenge that we've had here in the High Country are the number of people that do not have a good internet connection. That's been a problem. So those folks can talk on the phone. We have increased our behavioral health visits by about 50%. So we're at 150% of the counseling sessions that we had prior to COVID-19. With our dental practice, we're down, we're gearing back up now, but we were down 85%. And just to try to go through all the logistics and say, okay, what's the health department saying? What's CDC saying? And all the people that have rules that we need to follow. And it has been a journey to try to understand it all and provide the best care possible to our patients. Our medical care for about a month was down by 50%. A couple of things we did was, if anyone was coming for a well check, we had those in the morning. And if anyone was coming that was sick, we would have them come in the afternoon. And so we tried not to have sick people and well people here at the same time. And our schedulers tried to make that happen. There's just a lot to figure out with all of this, and wearing the masks. And every day when I come to work, the first thing that happens is they take my temperature and ask me a list of questions. Have you been exposed? Have you had a cough? All of those things. So all of our employees are checked as they come through the door. We also do that with patients. There was a time where we were instructed not to have sick people that have a cough and a fever come into the office, but we would go outside into the parking lot and the provider would go out and visit with them. And that's still the case. If we suspect that they have COVID, the provider will go in the parking lot.
And you kind of lead into a kind of a sidebar question here. Are you seeing COVID patients, and can you do testing at any of your facilities?
Okay, we have had a positive result, but it was not in this county. We have not seen a lot of positive results in Watauga County anyway, compared to the other counties where we were. And it has been a struggle. It was difficult to get the testing at first. We work with LabCorp, and they have different ways where they're FDA approved or not FDA approved. Would we test for the antigen or would we test for the antibody? And so just trying to work our way through that. So where we are now is this. We currently still send those tests. We collect the specimen, we do the nasopharyngeal, and we send it to LabCorp, and we have the results in a couple of days. We're getting the results back a lot more quickly. Within the next 2 weeks, we will have available point of care testing so that they can come in our office and be tested, and we will have the results within 15 minutes. But we had to wait for that testing to be developed, get the equipment, get the software on board, and now we're waiting for those test kits. And they have told us that they could be here anytime within the next 2 weeks.
Yeah, and the supply has been a big piece of that, but great to see continued gains in not only number of tests available, but types of tests available, and some of the wait times being shrunk there too. I know that one of the byproducts of COVID has been job loss. We've talked about that a lot here in this community. We were hit especially hard in the tourism industry, and with those job losses, for many people came benefit losses that have gone with that. How have you all been able to help? I know you mentioned that you see people regardless of their ability to pay or insurance mechanism that they may have, but how have you seen kind of that unemployment rise also match up with maybe some other services that you have to help people at this time make sure that they're able to maintain that quality of care despite the life-changing situations that they may be encountering on other parts of things?
Yes.
Yeah. So here at High Country, we have several CACs. So we are certified application counselors, and we go through training so that we're able to help people sign up for insurance through the Affordable Care Act. And that's regardless of whether they're patients of ours or not. It's a community service. It's a free service that we provide. We walk them through the whole process from the application to choosing a plan that benefits or that covers their needs. And actually with the losing coverage, whether that be from an employer, Medicaid, Medicare, anything that's considered a life-changing event, which, losing your job and all of those things would trigger a special enrollment period. And after someone's gone through that qualifying life event, they have 60 days to sign up for a plan through the Affordable Care Act, or some people know it, Obamacare. Through the Affordable Care Act, they can apply for a tax credit or a subsidy, which is based on their household size and income. They have to make between 100% and 400% of the federal poverty level. So they do need to have some sort of income or have had, whether that be at the beginning of the year or plan to have it throughout the remainder of the year, because it's based on your projection for the year. So just because they're not working right now doesn't necessarily mean that they wouldn't be eligible. They would just have to make a projection as to what they think they will earn by the end of the year. And again, that has to fall between 100% and 400% of the federal poverty level, which right now for a one-person household would be between 12,490 and 49,960. Anyone who's making in between those ranges can fill out an application and find out what they're eligible for. And again, it's going to be based on their household size and that income. That subsidy is applied towards their plan that they choose. And right now, Blue Cross and Blue Shield is the only company that's offering plans up here in the area, and they have really good plans. We've seen people get plans and really, really good coverage for sometimes as little as $0 a month. So if they're making closer to the 100% of the federal poverty level, they're obviously going to qualify for more assistance. And again, we've seen people pay $5, $10 after their plans have been subsidized.
Well, and I think that range that you mentioned there, I think people would be surprised if they don't know intimately. They would be surprised to find out just how many people in this county fall into that bracket of income too. So very important service that you're able to help people with for sure. Kind of as we wrap up here, and we've talked about this kind of in a roundabout way, but maybe more direct, what are you seeing people neglecting right now in terms of their health care? Again, with reluctance to maybe put yourself in a situation to be in the lobby office of a medical provider, given all of the things that we've heard, as people are venturing out, what are some of those things that you're seeing that have been maybe put off that need to be priorities rather than back burner type items?
Well, as you know, we all have a tendency not to pay the attention to our health that we need to. And during this time, when some people have lost their health insurance, and even people that have health insurance, they don't go and get the things that they need in order to be healthy. And I have friends who have been laid off or been home, stayed home, and they say, wow, I've gained 10 pounds because of the COVID virus. So, but then I think also people haven't eaten as much fast food during this time, and they're maybe getting more vegetables and healthy food choices than they would with the fast food. But I do think that it's important, even though someone might be fearful to go to the doctor to ask questions, that they should go ahead and call and see if they could possibly see their provider on the phone or with a virtual visit. And I do think it's important for all of us to be outside in the fresh air. I think that's important for our health, instead of sitting inside watching TV and watching the horrible news that's on right now. Yeah. To get outside of ourselves and enjoy the world that we have here in one of the most beautiful places on earth.
Yeah, Alice, you mentioned an important part of that virtual visit element. Now, I've heard other providers talk about how that's actually increased their ability to see patients from a mental health perspective. Have you all seen the same, that new availability of a way to connect with a physician has been helpful in that regard?
Absolutely. Absolutely. And we've had people who have been hesitant to have behavioral health, to have counseling before, that have said they were a lot more comfortable talking on the phone than they were sitting in the room face to face with someone, and that they would like to continue doing it that way even after they're available face to face. So there are some tough things that have come across with COVID-19, and then there's been a few good things that have come out of it as well.
Well, we certainly appreciate you both taking the time to share not only the valuable services that High Country Community Health provides, but also how you are actively trying to seek healthy outcomes for folks. That's very important that we're pooling as many resources together as possible in the healthcare world to take care of all of the needs that we have here in this community. And I know you all are doing very important work, and it is very much appreciated. So thank you to you two and your staffs for what you're doing. And we continue to look forward to opportunities to get more information about what you're providing out to folks, and hope that we can build those connections. So thanks for spending some time with us today.
Thank you, David.
Yes, thank you.